This is Med School Radio. Welcome back to Med School Radio. This is Simon. And we're looking at sketchy microbes, bacteria, this time gram indeterminate. We're looking at Chlamydia, trachomatis, pneumonia, and something called pistachio, or Chlamydia pistachio, difficult to pronounce, the pirates of Clam Island. So we can see a ship on an island with palm trees and monkeys hanging off the trees. You can see some crows in the crow's nest on the ship, which is on the sand. You see a parrot. There's a pirate, and he's got a wheel, which is supposed to steer the ship, make you think of something. And you can see 3 axes as the flag. And there is a skull and crossbones, which seems to be in the shape of the ovaries and fallopian tubes. Maybe, let's see. There is a treasure on the island, and there is a lady in front of the ship, and there's also a sign that's saying no mermaids, a monkey looking through the opposite end of a telescope, some shells all around, and some different sized pearls, it looks like. Anyway, and something jumping out of the water. Anyway, let's read it. It's kind of a long one, but if you've been to Sketchy Micro, you're going to know what this image is, and you should understand this chlamydia. Okay, so number 1, the White Island, gram indeterminate, does not gram stain. 2, stuck on an island, obligate intracellular bacteria. 3, stuck on an island, cannot create its own ATP, which is why it is intracellular. 4, no mermaid sign. What does that mean? Lack of muramic acid in the cell wall. 5, pearls outside of the cell, elementary bodies, first stage of life cycle outside of the cell. This is the infectious form. Elementary enters the eukaryotic cell and are taken up by phagosomes. Elementary enters, not sure what that means. 6, pearl inside the clam, reticulate body, second stage, and is active and multiplies, aka the dividing form. Reticular replicates to form inclusion bodies seen under microscope in cells when infected. Reticulate replicates. Number 7, pearls spread everywhere. Inclusion bodies seen when under a microscope. 8, treasure chest of gems, visualized using a GEMSA stain. 9, the gnats around the treasure chest, diagnosed with an NAAT test, NAT test, aka PCR. 10, monkeys and pirates slapping the knee, Reiter syndrome. Reactive arthritis, cross-reaction of antibodies fighting chlamydia, hits knee or sacroiliac joint, can't see, can't pee, can't climb a tree. 11, symptoms of trachomatis, 3 types. First one is A to C, blindness. The pirate is blind. Trachoma, leading cause of blindness in the world. And the second one, hand shield, sun from the eye. Okay, he's shielding his eyes from the sun. Transmission, hand to eye contact, possibly from fomites. Okay, on the next side of the PDF, it says mermaid is at the head of the ship. D through K, STI, not quite sure what it means. Okay, 1, scene takes place in the water and leak in the ship. Oh, I see the leak. It wasn't something jumping out of the water, it was a leak in the ship. Most common bacterial STI in the US, watery discharge. Gone has a mucopurulent discharge. 2, flying the Jolly Roger uterus flag can turn into PID, pelvic inflammatory disease without symptoms, ectopic pregnancies as well. 3. The mermaid is shielding the baby's eyes. Oh, I see. As holding a baby, shielding the eyes, wearing a clamshell bra. Baby can get infection if the mother has it during delivery, giving it neonatal conjunctivitis and pneumonia. The baby will present in 1 to 2 weeks with a possible cough. Staccato cough, it says. Or conjunctivitis. Gonorrhea will present in 2 to 4 days. B, L1 through L3 LGV. Don't know what that means. Okay, then it says 1, mermaid with barnacles around the inguinal region. I see. Lymphogranuloma venerum, infection of the inguinal nodes. Presents with tender lymphadenopathy with draining lymph nodes. 12, clamshell bra on the adult mermaid. Chlamydia, pneumonia, walking pneumonia, more common in the elderly. And the parrot, Chlamydia pistachiae, I can't pronounce it, transmitted by birds, causes pneumonia and transmitted by bird droppings. 14, the treatment. A, the crows means macrolides, azithromycin. B, the bicycle wheel, tetracycline. C, confection of chlamydia and gonorrhea. Treat with ceftriaxone. So there we have quite a long one there from Sketchy Micro talking about chlamydia. Remember that is gram indeterminate. So check it out on Sketchy Micro if you want to get the full picture. Thank you very much.